Welcome, everybody. I want to introduce to you Dr. David Hanscom. He's he's a back surgeon that was in the field for 30 years, and he's been able to make a big impact in the mind-body space. And so, without further ado, thank you for being on my show. I really appreciate it. And I know a lot of people could benefit from talking to you or having your input, Doctor.
Yeah, thanks. No, I appreciate being here. So it's a big topic. I quit my surgical practice to do this, and I have watched hundreds of people being totally trapped in pain and completely heal. And I've been sort of shocked every time this happens, but it's consistent. So yeah, I quit my practice in 2019 to get these concepts out into the public domain and slowly making some progress. So I appreciate being on your show.
Thank you. Could you tell us a little bit about your history with, being in the field? Was it 30 years? You're a back surgeon. You've seen all kinds of cases, and what was that like for 30 years?
Well, I was trained at a very high level spine fellowship, one of the top five in the world at the time. And I came out of there with a real mission to do back surgery because I thought, like every other surgeon, that back surgery was a definitive solution. And I felt badly on a given patient if I couldn't find a reason to not do surgery. So for the first 7 years of my practice, I was very aggressive doing surgery. And the operation that had just hit Seattle was called a Steffi plate, which is the first time we really started putting screws in place into people's spines to get a fusion. And I was excited about it because all of a sudden we had a way of reliably getting a fusion. And so from about 1986 to 1993, I was very aggressive, did dozens and dozens of fusions of people with back pain. And I asked my partner one day, I said, well, what are the results of this? Because it's a pretty big operation. And he said, we don't know. I don't know. I go, huh. So what happened, I looked at my data and I was having about a, 50% success rate, whereas I thought it was in the 90% range, because again, it's a big, big operation. And then in 1993, a paper came out written by a friend of mine, Dr. Gary Franklin in the state of Washington, looking at back fusions in people on workers' comp. Guess what the success rate was 2 years after an operation for back pain? Basically a fusion, welding the spine together. Just take a guess what
Yeah,
the success rate was.
um, 10%.
It was 20%.
Okay, that's a pretty good guess.
Yeah, it's very much better
Wow.
guess than most people by far, but that was it. Then the data came
Yeah,
out eventually after I quit practice that if you operate in the presence of chronic pain, which by the way is a neurological problem, not
right.
structural, that you actually make the pain worse 20 to 40% of the time.
Yeah.
And it can become permanent. So you actually have a higher chance of making people worse than actually solving the problem. And what made me crazy eventually was that um, there's no correlation between disc degeneration, arthritis, bone spurs, herniated disc, and back pain. None. No
No.
connection. So
Right.
we're basically finding you have with normally aging spines. So your spine becomes stiffer as you get older. As the disc degenerates, they lose water and they lose flexibility. But there's no connection between disc degeneration and pain. Yet it's the most common reason we do surgery for back pain. So we're operating on normally aging spines that have been
Right.
documented to not be the cause of pain, and we're upwards of $20 billion a year operating on normally aging spines.
Right. So when people they have the pain, they look for the MRIs, and then they're like, well, there's pain there, so they look and they're going to find something, but what they're finding is what? A normal abnormality?
Yeah, I wouldn't call it an abnormality. It's just a normally aging spine. So as you
Right.
get older, your spine gets stiffer. So yeah, your joints develop arthritis, the discs narrow down. People come into me all the time saying, well, I have my spine's bone on bone. Well, what that means actually is that the spine sort of welded itself together, is not moving. So that quote
Right.
bone and bone is probably the least likely source of their pain.
So in a way, our body adjusts, adapts to our with age, and the way it does it, it's working perfectly fine. But when we
Right.
see it, we assume that it's wrong or needs fixing.
Well, yeah, and the problem is that the studies they've done, they've taken 100 people off the street and done MRI scans on them. And what they find out is that 100% of people over age 65 have degenerated spines, but they have no pain.
Right.
And when you're like 30 years old, it's like 25% of people have degenerated spines, bulging disc, ruptured disc, and they don't have pain. So the connection between pain and disc abnormalities and spinal arthritis is essentially zero. Yet that's one
Right.
of the biggest sources of surgery revenue that's in the country. And one of my research friends pointed out real succinctly that if you're operating on normally aging spines, that you have an endless number of people you can operate on,
Right.
right?
So then that also kind of translates why younger people now are having back problems more than we used to see. And if it has nothing to do with the spine, then you can see that it's the mind is being more affected with maybe the more stress that we're dealing with these days.
Right.
Because if like a young spine should be right, it should be working perfectly, somewhat.
Well, it does mechanically. I will say that I mean, the disc can cause pain. It's more in younger patients, not chronic pain. So,
Right.
you know what causes chronic pain? It's been documented in a major research study out of Israel. What causes chronic back pain is lack of sleep.
Hmm.
Lack of sleep actually causes back pain, and it's not the other way around. Very large study out of Israel done about 10 years ago, documenting that lack of sleep is probably a major factor in causing chronic back pain. So if you have a
Right.
young patient with a disc problem, they can bend, twist, the discs are mobile, which means they can tear a little bit. You can have acute back pain and spasms from injury to the disc, but that's not chronic pain. Chronic pain is totally different than acute pain.
Right.
So with acute pain, you bend, twist, strain your back, it hurts like heck. People go into really severe muscle spasms. They think they're going to be paralyzed, and understandably so. And so most of those resolve, but they found out that half the time that these acute pains become chronic. So we were taught maybe 10%. The real number is actually about 50% become chronic. And what happens on these research MRI scans is that the pain goes from the back pain center on the MRI scan and it goes to the emotional center. So you have the
Right.
same pain, but a different driver. So it's the same pain, but the driver comes from the emotional centers, not, by the way, physical pain and mental pain go to the same part of the brain. So as part we'll get to later on in this talk, because you asked when an orthopedic surgeon has done what I've been doing. Well, going back to my story, in 1993, about 8 years in my practice, being super aggressive, I stopped doing spine surgery. But in 1990, I had a panic attack. So I went from
Right.
being a fearless surgeon to a crippling panic attack. And from that point on, I started developing crippling anxiety. I also developed 17 different physical and mental symptoms at the same time:
Right.
migraines, ringing in my ear, back pain, chest pain, stomach issues, bladder issues, feet burning, redness in my legs, skin rashes. It was unbelievable. And jump way ahead of the story, they've all resolved. I don't have any of them anymore.
You've experienced what it's like to have the anxiety, let's say, the looping thoughts and what it's like to sit in the trenches and know exactly, how you got out of it compared to somebody who theoretically, well, technically it's just this and that and that. And I'm still grateful for some of those people that are helping out in those ways. But there is a difference when you have somebody who's been through it and understands what the person's going through. It's a big difference.
Well, the other thing is I also went through this for 15 solid years. That's a long
Right.
time to have all these symptoms. And so I came out of it by accident. I did not know how I got into it. I did not know how I came out of it. And so in 1990, when I had that panic attack, my feet started to burn, my ears started to ring. I ended up with a spine surgery in, oh, what year was that? 19, what was it? I had had back surgery in 1986 where I ruptured a disc, had surgery, ended up with a post-operative infection on top of it. So I had back issues also. But it wasn't until I hit that panic attack in 1990, crossing the 520 bridge in Seattle, that everything just fell apart. And from that point on, I could not stop it. So I'm going to jump way ahead of the story and work backwards again. So I did not know why I get these symptoms. I went being from a fearless spine surgeon to crippling anxiety in one day. And I could not put that genie back in the bottle. So I went on this relentless search to find out what happened. So I went to doctor after doctor. I read the books, I read textbooks, I read internet stuff. I became an epiphany addict. I was looking for a solution to my pain because I was so freaking miserable. It was unbelievable. And I understand. So that's why I call it the abyss, is that you're bounced around the system. Nobody's telling you what's wrong. Nobody's telling you how to get out of it. You don't have any hope and you're totally trapped. It's a very dark place to be.
Plus, you got the labels that's given to you in the
Yeah,
belief system.
right. Yeah. And so the problem is in medicine, we've completely missed the boat. So medicine does not have hardly any data for what we do in chronic disease. We do miracles with acute disease, but with chronic disease, we completely miss the physiology of chronic disease. So I don't use the term mind body anymore, by the way. It would
Yeah.
just be unit. So the way
Mm.
we survive, remember, our bodies taking sensory input in from the skin, temperature, eyes, nose, throat, all sorts of things are coming into our body. So our brain's interpreting all these signals. So I call that the input is
Mhm.
processed by your nervous system through all these sensory receptors, processed. Your brain's correlating about 20 to 40 million bits of data per second. A lot
Mm.
of input. Then sending out signals about your body's chemistry to either what we call threat physiology or fight or flight or safety.
Right.
So what we call stress is just your adversity, challenges to life, perceived danger, that's threat. So people think stress is psychological, right? Not true. Stress is any perceived threat.
Yeah.
That's not psychological. So it could be a dog coming at you, could be a bad boss, could be your spouse and you get into an argument, could be your kids behaving badly. Those are all threats that your body perceives as danger. And you go into a threat response. So people think that if I feel stressed, I must be a wimp. I'm not coping very well, et cetera, et cetera. And your body's doing what it's supposed to do, is protecting you. So
Yeah.
you have this stress response. It gives you fight or flight physiology. So the fight or flight physiology is about processes about 20 to 40 million bits of information per second. Guess how
That's
much
fast. That's great.
guess how much your conscious brain processes?
Yeah. That's amazing.
40. 40.
Yeah.
So your unconscious brain is 20 to 40 million pieces of information per second. Your conscious brain is 40.
Yeah.
It's a million to one ratio. So you have this massive survival reaction. Then you have your conscious brain over here. And so they're obviously connected, but they're two unrelated. I'm sorry, they're linked phenomena, but they're separate. Anyway, so we have a model called dynamic healing that you have your stresses or challenges. You have your nervous system interpreting the signals, and you have your physiology, which is the output. Then that creates symptoms. That's all physiology. That's not structure. So they have a term called MUS. Have you heard of this term called medically unexplained symptoms?
No.
It came out about 2002 in the family practice literature. It's called MUS, medically unexplained symptoms. So if you can't see it on a test, it just, they don't know what's going on. The problem is when you're in fight or flight chemistry, every one of your 30 trillion cells in your body is bathed in fight or flight chemicals, right?
Yeah.
So all the symptoms I had are explained by the physiology. So it should be medically explained symptoms. So as I learned tools to, you can't control your physiology, but you can regulate it. As I learned to put my body more in safety than in threat, the body heals. So my
Yeah.
migraines are gone. My ears don't ring. My feet don't burn. Skin rashes don't show up. I don't have anxiety. I don't have depression because my body chemistry is in safety, not in threat. So the evidence of the evidence of chronic symptoms, illness, and disease is sustained threat physiology, breaks your body down. It's like driving your car down the freeway in second gear. It's going to break down. So your body breaks down, you develop symptoms, and structural changes are the result of your immune system tune up your body.
Mm.
And we know chronic stress causes symptoms, illness, and disease. Chronic stress shortens lifespan. So again, I always
Mm.
thought it was psychological until I understand the cascade that's actually your threat translates into physiology, translates into symptoms. In medicine, we're treating only the symptoms. So if your stresses are high or your nervous system is a little bit hyperactive and you're in threat physiology, the root cause is that interaction between your stresses and your coping skills. We don't know our patients very well anymore. We don't have
Right.
where time is taken away from us. We don't know your coping skills. Plus, we're not teaching them to you. We're not teaching people how to regulate their physiology or the threat response. And so the root cause is the interaction between your stresses and your coping skills. And we're treating only the symptoms at the end of the line. It can't.
Right.
So what happens the way you get people to heal, which is dramatic, you teach people skills to actually lower threat physiology. You can't get rid of it, and increase time in safety physiology. And when you're in safety physiology, your body actually regenerates, puts fuel into the cells, and instead of having inflammatory chemicals, you have anti-inflammatory chemicals. And then when you're in stress physiology, the inflammatory cells in your brain fire up. Your brain itself is
Mhm.
inflamed. So your
Yep.
brain actually creates all these symptoms that make no sense because your brain is actually inflamed. So as you calm everything down, including your nervous system, symptoms disappear. Every one of my 17 symptoms is simply gone. They've been gone for about, God, 20 years now.
Right.
If I'm stressed out, those pathways are still there. So if I, get too wired, all of a sudden the skin rashes pop up, my feet start to burn, my ears start to ring. But I just look at that as a signal that, okay, my body's in stress chemistry. That's it.
And
You
you
know?
know what? It's not necessarily a bad thing. It's just telling you where you're at.
Correct.
It's indicator to where you're at, and you can do something about it. Right. It's
Absolutely.
I think it's a great thing.
Yeah. It's just, I tell people to learn to read your body. So instead of going to the
Right.
doctor to get rid of your burning feet, go ahead and just learn how to calm down your stress chemistry. So
Yeah.
a couple of the layers to this. So people generally think anxiety is a psychological disorder. Is that a fair statement?
Yeah. Most
Okay.
people. Yeah.
So your brain is not a control center, it's your relay center. So your body, if a dog starts charging at you, your whole body reacts. You have visual cues,
Yeah.
you have sound cues, and your brain is programmed to know this is danger. So your whole body responds to the chemical reaction. It's not just your brain. So your brain's not just saying this is danger. Your brain is actually understanding that you have a problem coming. So your whole body is reacting to that threat. That's why I don't use the word mind body anymore, because it's just a unit. If you didn't have the brain to interpret
Right.
the sensory input, nothing's going to happen. And you can't fly a
Right.
Boeing jet without a computer. A Boeing jet only has 2 million parts, and you can't run your body without a nervous system. And your body system has 30 trillion cells. So it's just a relay center, it's just a unit. So the reason I
Yeah.
don't call
So
it
it's all one working
correct,
together as
right,
one entity, one organism that works together. Yeah.
right. So as we evolve in humans, the nervous system evolved late to adapt to language, etc. But let's say my cat. Okay, so she has all the sensory input. She knows what's dangerous versus not dangerous. She reacts in a way to stay safe and to stay alive. So her brain's adapting every second to the environment. It's
Right.
very neuroplastic. So if a given person scares her, that only has to happen once in a cat or a dog, right? They remember.
Right.
So in order to survive, your brain actually memorizes everything.
Hmm.
I mean, how many times do I have to touch a hot stove before I quit touching the hot stove? Only took once.
Right. Yeah.
And and your unconscious brain keeps you alive. So, but if you're threatened by your boss or whatever, how do you feel? There's a big chemical reaction.
Yep.
It's powerful. The feeling that's generated is anxiety. You feel anxious or afraid. So
Right.
it's not a psychological diagnosis. It's not the cause of the problem. It's just the word humans use for that chemical reaction. So the reason why it's so critical is that chemical reaction, again, is a million times stronger than your conscious brain. If you treat this chemical reaction psychologically, it's a million to one mismatch, and you can't control it. So something causes anxiety, you take action to solve the problem, your body chemistry drops down, you calm down and go on your way. Except,
Hmm.
what if you can't control the problem, like chronic pain? Your body kicks in more chemistry, more intense chemistry,
Right.
you become angry. So anger and anxiety are the same thing.
Yeah.
It's very in intensity. chemical makeup. They're both chemical reactions. I try to get people to get rid of the word anxiety, just use the word my threat physiology is activated.
Right.
And if I'm trapped, my threat physiology is more activated to try to escape. So it's just so anger is just a more intense chemical reaction, but it's also destructive. It's going to do anything you can to stay alive, doesn't care about the
Right.
consequences, right?
Right.
But
It
the other
doesn't care if you
problem is,
suffer.
right, but the neuroscience of anger is that your thinking brain goes offline. You actually cannot think clearly when you're angry.
Is that the fight of the flight reaction?
Yes, fight or flight.
The fight is the anger,
Yeah,
right? The anxiety is the flee,
right,
right? Or to investigate. The OCD and the doubt is investigate for the danger, right? And go look for that, the intruder. So it's getting you to, look for the danger, which makes sense.
right. So it's up to you where you want to go with the conversation. I mean, I personally think that the mental pain is a much, much bigger problem than the physical pain.
I think it's everything.
It's
The mental alarms, if when you recalibrate the mental alarms, the body just follows suit. That's how it worked with
it's
me.
actually the other way around. Again, that's what's missed in the medical world right now is the physiology of thoughts. So in the dynamic healing model, your thoughts are input. So unpleasant thoughts actually fire up your threat physiology. So what happens, your thoughts reflect your body's chemical state. In other words, your thoughts are an interpretation of your body's chemistry. So as my friends have pointed
Right.
out, your thoughts sort of, which word they use, they come up through the soup. Your thoughts keep coming up, bubbling up through the soup. And so your thoughts are a reflection of your physiology. So if you're anxious and frustrated, your thoughts are going to be unpleasant,
Right. Of course.
right?
Yeah.
And since it's a million to one ratio, if you try to control the thoughts with more thoughts, it's a mismatch, number one. So the key issue is you have to calm the physiology, then the thoughts start to drop down. Then the thoughts themselves also fire up the physiology. A threatening thought gives you the same reaction as a physical threat. So you have a bidirectional problem of the thought causing the physiology to fire up, but many other things cause physiology to fire up. So the physiology drives the thoughts. What's happened in medicine, we're dealing with just the thoughts, and we're not again
Yeah.
addressing the physiology. So it turns out anxiety, depression, OCD, bipolar, and schizophrenia are all actually physiological states. They are not psychological.
So how would they if they think it's a body thing, how would they regulate that?
Well, that's the whole process I do with people that I've learned myself, that I teach other people, is that you cannot control the survival reaction. It's instant, it's automatic, it's powerful, and we have no say over it, right? It's an instant reaction. You get a threat, you react,
Yeah, it's that the quick rush, the flash fear, right?
right?
The amygdala takes over. You don't have a choice, right? And it's gonna protect you because you're not in the driver's seat anymore. The amygdala is in the driver's seat now because it's got to protect you. That's its one job.
Well, it's a little more complicated bit, but that's basically correct because
Yeah.
it's the bottom line is not happening in the frontal lobe. It's a whole part of the brain. There's a cortex which has a lot of consciousness. The neocortex in humans adds abstract thinking to it. But we're definitely in the cortex midbrain limbic system as far as causing that survival reaction. So again, the survival reaction we call it threat physiology, is that the neurotransmitters or the chemicals in your brain go from calming to excitatory. Your brain itself becomes inflamed. You have cortisol, which takes fuel out of the cells, breaks things down. Then you have your stress chemicals, which just starts heart rate, blood pressure, sweating, all those go up under stress. So it's not just adrenaline, it's a whole body response to a threat. So we have
Yeah.
no say. So let me ask you a rhetorical question, which is I'm not intending for you to answer it, but let me just ask a question for you.
Okay.
Anxiety and anger are automatic survival reactions. They are a gift. They keep us alive. How long
Yeah.
would we live without anxiety and anger?
How long do we what?
How long would we live or survive without anxiety and anger?
Probably not long because the tiger would eat you alive.
Was that?
Because the tiger would eat you alive
Yeah.
without an alarm system ringing, right?
Yeah. I mean, just crossing the street, eating the wrong food, looking at the sun. I mean, Our survival reactions are instant, they're automatic. Our brain memorizes everything to have these powerful survival reactions that are not subject to rational control, period.
Right. Yep.
So again, it's a million times stronger than your conscious brain. So talk therapy certainly is not going to control this thing. When I give lectures, I have a picture of a dragster that requires a parachute to stop it. And so it's 11,000 horsepower in a dragster. So trying to control your anxiety and anger, I'll just use the word threat physiology. It's like trying to stop that dragster with bicycle handbrakes. It's not going to happen.
Right.
So we think of all the energy we use to try to calm down our threat response with talk therapy, et cetera. It's a complete mismatch. It's not going to happen.
Doesn't work. I know. I tried it. It doesn't work.
So if your anxiety and anger, again, both the same thing, both survival reactions, are not subject to rational control, how do you lower anxiety and anger?
Right.
What's that?
Well, well, for me, I could tell you how I did it. For me, I did do it with the psychological way, but I did it differently than than what you usually learn on, YouTube or therapists. It's a little different. So I took the resistance away. So with, trying to stop a thought, right? Especially an OCD thought, it's telling you you're fight or flight. This is gonna explode. This is gonna be like it's relentless looping thoughts that are telling you go to the hospital. This is gonna happen. Blah blah blah. Right. And for me, what I used to do, this was what made things worse, was I would try to distract. I would try to make deals with it. I would try to figure out, analyze, and try to find, you know, an answer to resolve that alarm. So instead, because the more I did that, the more I resisted. What you resist persists. The more the alarm got bigger and bigger and bigger, and then my baseline would go up, and I would just get more of those alarms that I don't want. So I was stuck. So eventually, what I had to do was allow those thoughts to be there. Let them do their thing, right? Let the energy just flow, right? Let myself get in a state of fight or flight and let it do its thing, surrender to it. And with repetition over and over and over again, eventually it would update the alarm system because I was sending a message of safety while I was in the danger instead of sending a message of danger while I was in the danger, right? And my brain would update and go, okay, well, we're safe because I wasn't white knuckling through the process. I wasn't resisting, right? Sending a message of survival while I was having the thought. I was changing my response to allow, let it do its thing. And I would still feel like shit. I would still be scared, but eventually I'm doing the long work, right? Eventually the alarm would go from a 10 to a 5 to a 3 to a 1. And doing this with repetition for 3 years, this is also gut issues, food sensitivities, right? Eventually, my baseline was started to come down, and it took a while. I would have setbacks, right? But these were all opportunities for me. I needed the setbacks. I needed to have the shitty days because they were opportunity for me to update the alarm system. So it was really hard work, but I understood that this is the journey. And eventually the baseline came down, the alarm started to turn off one after the other, right? And I was also using my body to express a message of safety with walking, dancing, I did visuals for an hour every day, never missed a day. It's been actually 4.5 years. I haven't missed a day still. I'm fully recovered,
I'm
but I
sorry,
still do it.
doing what?
Visuals. So mental visuals to bring myself into dopamine, oxytocin, serotonin, endorphins for an hour a day. And then dancing, elevating my mood, thinking greater than I feel, kind of mentally leading myself to the new program while letting the old program do its thing. So this is, and I would still feel like shit because I'm feeling that old program. So I'm opening that door, feeling the old program, but I'm still leading in with the new program. And eventually it started to update and I started to feel the updated program of ease instead of the dis-ease that I was having before. And that took me
Mhm.
3 years. And it was a shit show. But eventually everything regulated. I was able to eat all the foods again because I had two safe foods that I could only eat for 2 years, right? Two safe foods. And then my OCD left, the PTSD, the anxiety, all that stuff left and regulated. But it was very difficult. But I see a lot of people that do this brain retraining and they do a lot of resistance where they're like distract, redirect, stop, right? And when they're doing that, they're not allowing the alarm to be acknowledged. They're resisting it, So when it does that, it's trying to get your attention to the perceived danger, but you keep ignoring it. So what it's going to do, it's going to get bigger and bigger and bigger because its job is to get your attention to the perceived danger and keep you alive. But people keep distracting from it, so they're stuck in this cycle of fight or flight. The baseline skyrockets, right? When it skyrockets, you're going to get more alarms. Makes sense, right? It's not a bad thing. It's not a good thing. It's just
Right.
doing what it's supposed to do, and you're giving that information. You're programming your brain with the way you're responding, right? This
Right.
software, you're running the software. You keep
Right.
putting the same software program in there without, uh, and I understand because it's in a way the way you're supposed to respond is kind of opposite of what people think they should. So it makes sense why people get stuck. And where you look nowadays, there's a lot of misinformation out there of how to really recover, right? And for me, it's like the best way to really learn is to listen to people that have actually fully recovered and been through it, been through the trenches, right? That's the pudding. That's where you really understand. No, go towards it. Ask for more. Let it do its thing, and then engage in life. And trust me, keep going. Even though you feel like shit, eventually it'll catch up and regulate the alarm system. That's how I did it, but it's
So
difficult.
so I'll just say one thing really clearly. I mean, you actually figured this out. So
Yes.
there's different language to describe it, but I'm super impressed. It took me 15 years to figure out what you just figured out in three. So I can now
Yeah.
help people in 3 to 6 months come out of it, but it took me a huge amount of suffering. And as you know, these intrusive thoughts are brutal. And there's a direct link between intrusive thoughts and suicide. And humans commit suicide. Most mammals don't. And the worst part of my ordeal is I had severe OCD, unrelenting intrusive thoughts. I could not escape them. And in 2002, I almost checked out. And if
Right.
you told me I had to live with that degree of intrusive thoughts the rest of my life, I'd say, fine, I'm out of here. It wouldn't even be a close call. But it turns
Yeah.
out my patients, when I talk to them carefully, that the mental pain is the bigger problem. The inability to escape these thought patterns is just brutal. And so I can see people's physical pain drop down and how the mental pain persists. So I'm writing a new book on, I call them ruts, repetitive unpleasant thoughts. So these unpleasant thoughts are input, right? So thoughts are input, your physiology is the output. So you get your stresses in input, you have your nervous system, which can be calm or hyperactive, and you have your physiology, which can be safer and threat. So unpleasant thoughts come in, they go through your nervous system, and they create threat physiology. Well, then the
Yeah.
threat physiology fires off the unpleasant thoughts. So what's missing in medicine, and the metaphor I like to use is that of a hornet's nest. You would just visualize a hornet's nest being your brain, and the
Yeah.
hornets being your thoughts. The hornets are just doing their thing, being what hornets do, and then somebody shakes the nest. Well,
Yeah.
they're not very happy. And so what we do in medicine, we're trying to treat the hornets outside the nest. Calm them
Right.
down, kill the thoughts, try to get them back to the nest, whatever it is, where the answer is quit shaking the nest.
Exactly.
Exactly. So what you described is very much that way. You watch thoughts come, you watch them go, and you learn to, and I don't like the word acceptance, by the way, but you describe what I call being with the thoughts, training your brain not to react to them. And you have to train your brain to do it because willpower doesn't work. You just train your
Yeah.
brain to not react to the thoughts. So you calm down the nervous system, the thoughts drop down. The thoughts drop down, the nervous system calms down. Then the third
Yeah.
phase of this, again, all this occurs at the same time, is actually you start killing your ego
Right.
because your ego is what's keeping your brain spinning this need to have an ego. And the stronger it is, the more powerful it is, but it takes more mental energy to create this ego. And so once you realize that these thoughts are just thoughts, most of them are what
Mm.
we call cognitive distortions. You just get to watch them, let them go. Your ego starts to dissolve and becomes more flexible. So the need to
Yes.
defend your ego creates a tremendous impetus for your thoughts. And so what happens is you learn to calm down, as you learn to let your ego soften, create mental flexibility, a huge driving force behind these thoughts disappears. But the real healing occurs. So that's sort of the preliminary steps. The definitive healing occurs with neuroplasticity. We recreate the brain of your choice. Right now, we're talking about repetitive and pleasant thoughts. They can be just occasional disturbing ones. They can be unwanted ones. They can be disruptive. And I had
Yeah.
what I call invasive, intrusive thoughts. full-blown OCD.
Yes. Yep. Had
And so
that.
they're way more, and people say, oh, I don't have OCD. Well, I have what's called silent OCD, where it was thought, counter thought. I wasn't washing my hands. I wasn't doing any external activities.
Right. Right. Yeah.
I didn't know I had it until I read this book about internal OCD. So you have thought, counter thought, and it never stops.
No.
So when
Yeah.
you're trying to fix the thought, you're actually frying up the physiology even more. So in medicine, again,
Yes.
treating the thoughts, we're not calming the physiology. But the preliminary step in this whole process is to realize this chemical reaction is what you have, but it is not who you are. It's protecting you, is impersonal. Every human being has a stress physiology. And remember, this is intended to be incredibly unpleasant. And so the thoughts that come out of this thing are
Yeah.
disturbing, they're destructive, they're bizarre, they're
Yeah.
really, really untoward thoughts. And that's why well-intentioned people have more trouble with intrusive thoughts than people that are sort of sociopaths, because
Right. Yeah.
well-intentioned people give more meaning to them. So I feel like this, I must be a terrible person, I'm worthless. The reality is it's just your survival physiology. So the first preliminary step in solving the problem is intellectually understanding to not take these things personally, these feelings.
Well, what I did is what I learned is that my thoughts, the content of the thought, is irrelevant because it's just there to get my attention, and it's going to always be something I don't like. It's never going to be pussy willows and rainbows. It has to be something that's going to get my attention. It's always something I don't like. So it got my attention to the root of the alarm, and it wanted me to acknowledge it. So with these intrusive thoughts, I would half the time agree with them, right? But I would do it myself so nobody knew what my whatever the
Right.
intrusive thought was. I'd be like, "Yep, you know what? I hope that happens today, and actually, I hope it happens. You better be there for the next week, the next month. You better be there." So I would totally take the resistance away, and I would agree with it, right? Oh, this is going to explode. Yep, I hope it does. You're right, and then I would engage. So I totally take the resistance away, let the energy do its thing, so that the baseline could finally calm down, and then I would engage, and that's how I with the intrusive thoughts in time, I let them die out and burn their own energy.
So I'm just curious. I just want to review this one more time just for your audience to understand this because you did it. So I'm really curious how you figured this out because most people do not, even mental health professionals. Let me just review this one more time.
Yeah, sure.
So you have the survival reaction that's very unpleasant, very untoward. And if you're a well-intentioned person, you feel bad about it, you give meaning to it. And so the first step is to not take these thoughts personally because they're just thoughts, just like you said. Then the four phases of it is one I call it thought separation. You can't control your thoughts, but you can separate from them. And we do it with what's called expressive writing, mindfulness, cognitive behavioral therapy, all do that, but they aren't the solution. They're just one part of it. The second part is calm the physiology. And there's a bunch of ways of doing that. And that's what you have to go to my website to really understand this. It's too much for this conversation, but there's a whole bunch of ways of calming down the physiology. We call it dynamic healing. The third phase is softening the ego and developing mental flexibility as opposed to rigidity. And the definitive phase is actually neuroplasticity, as your brain
Yeah.
changes by the second. If you're fighting the thoughts, you're reinforcing them, your brain will
Right.
develop where you place your attention.
Right.
So
Yeah.
that's how it heals, and it's very definitive. It's consistent. I had one young mental health professional in the South who came to me with 15 years of severe OCD, just miserable. In practice, nice wife, kids, everything you can imagine. And he was getting worse because I've done everything I can to be happy and I'm miserable. What do you do next?
Oh,
So, long story short, he went through the process I put people through. It's called the DOC journey, direct your own care journey.
yeah.
And it's not it's a series of concepts. It's not a self-help process. So you just learn tools of regulatory physiology as one skill set. The other skill set is nurturing joy, put your brain where you want it to go. You can't nurture joy to distract yourself because it doesn't work. So anyway, long story short, he blew out of OCD in about 3 months, blew him away because
Wow.
OCD in general is considered untreatable. And so that's why I'm writing this new book on repetitive and pleasant thoughts that I call ruts. And one thing I want to say about that really quickly is that unpleasant thoughts are input that fire up your threat physiology. So what do we do with these thoughts? What's the only thing I knew what to do is to suppress them. It
Right.
turns out that suppressing a thought actually fires them up even more, but it
Yeah.
also causes brain damage. Suppressed unpleasant thoughts are a bigger problem than expressed ones. So either way,
Yeah.
you're screwed. You cannot escape your thoughts. So that's why the
Right.
first step is to separate from your thoughts. And there's a bunch of ways of doing that. And you already described some of those. So I call it thought
Yeah.
separation is that first step. And you let your thoughts do what they're going to do. It's
Right.
when you
Yeah.
fight them is when you give them neurological attention. So anyway, long story short, I talked to him a few weeks ago, about a year after this all started, and he just is doing fine. But he
That's
spent
great.
15 years reading every self-help book in the world, but the attention's always on the thoughts. It's not on calming down the physiology.
Right.
So I'm curious, how did you learn this? How did you figure this out?
By doing all the wrong things.
Well,
Right.
that I know well.
And I kept and seeing the proof from other people that were stuck for years doing the wrong things. And I also um I heard from other people that recovered. Yes, I went through that. The more they actually, this is a phenomenon that I noticed. The more I was with the brain retraining thing, the more I was healing physically, the more my mental alarms skyrocketed, right? Because it seemed like, um, I was starting to bring my baseline down, but it wasn't down far enough. So I was starting to take away the supply, the alarm supply from my body. So the brain's like, we still need to get his attention. He's healing from all these things. These alarms are useless. So we got to create new alarms. Okay, let's give him anxiety. Let's bring that. Let's give him some OCD, relentless looping thoughts, because we really got to make that intense because there's still ligers in the room. There's still a tiger. There's still a threat. So all of a sudden, I'm losing my mind for 2 years with these mental alarms, and I was like, what do I do? And I started talking to other people. I'm like, did you go through this? Like, I went through the same thing. All of a sudden, my mental things went crazy. I'm like, so what did you do? So I had to jump ship from doing the brain retraining, and which was very triggering for me at the time because this is all I had, and I had to be open minded and try other methods. So there was ERP therapy. I dove into. I dove into the Dare response. It's a popular app that helps people recover from anxiety. And I became my own guinea pig and I experimented. And I noticed that, I used to have a safe room where I used to pace back and forth, trying to figure out, try to get the answers. I used to do opposites. So I try to make deals with my thoughts. I try to um, like whatever the thought was, I would try to negotiate with it. And I found out it was just all it was doing. It was just making it grow bigger and bigger and bigger. And then eventually I allowed it to do its thing. And I took away that energy from it. And it would go from a 10 to an 8, but I knew I had more work to do with repetition. And I was also doing programs with neuroplasticity. And eventually I just gave that up because I thought, my brain knows how to create neural pathways. I don't need to micromanage my body. Let it
Right,
do its thing. It knows how
right.
to create a pathway. My biome knows how to balance itself out. My this, my that, my whatever, whatever it is, will knows what to do. My job is just to um, implement the new methods of allowing, letting it do its thing. Going towards, and this is where the exposure came in. I slowly started doing exposure, and everything that I feared, whatever it was, if it was a symptom or a thought, became my new target. Right,
Hmm.
and this is where I would go towards my thoughts. I'd have daily. I would go, okay, what's the looping thought today, and I would bring it up, and I would go into detail about it. So I would be triggered. I purposely trigger myself, so I'd be like, "Ugh," and and I would just let it do its thing. I would sit there and let it do its thing, and I would repeat. Let's say I do some exposures. I would repeat what I'm fearful of that day times 15. Let it do its thing. Then I engage. The alarm would go from a 10 to a 5 to a 3 to a meh to off. And that's what I had to do. It was like a full-time job. It literally was a full-time job for me
Right.
with
Yep, I know.
experimenting,
Yep.
making mistakes, right? Going, oh, I see how the brain works. And after a while, because you're in the trenches, you can kind of see how the brain works. And you know what? It's not that complicated, right? It does all the hard work for you. It's just all it is understanding. And the only way you understand is by going through it, making the mistakes. And I think it was for all these years we've been giving the false information. We haven't been given a handbook. So that's why it makes it seem like this it's this crazy complicated world when it actually if you really understand it, it's not. The brain takes care of everything for you. It's actually there to support you. It's just that we've been communicating with it, misunderstanding it like a different language. And now I finally, through making the mistakes, through finding what does work, I I found the way with support with other people that also recovered because they've been through the trenches too, right? Just like you.
Right.
And that's how you do it. And staying on track, also knowing that it takes time, and just because you feel like crap, it does not mean that recovery isn't coming. It's not an indicator that you're not on the right path.
Yeah, again, I'm fascinated. See, there's so many things you have said that are pretty much, in fact, everything you said is actually on target. I don't disagree with anything. So I only would reword it a little bit is that the faster you can take the word work out of it, the better, because you're trying to
Yeah,
shift chemical state. So going back to the very beginning of our conversation, all chronic disease, mental and physical, including pain, anxiety, depression, OCD, bipolar, are all inflammatory metabolic disorders. They're not psychological. Now, the thoughts are the psyche, and suppressed thoughts are also the psyche, and the emotions are the physiology, is what you feel, but they're separated by nervous system in between. But thoughts are signals that the brain interprets as a threat and puts out threat physiology, which in turn fires up
yeah,
the thoughts. So the tools you're describing calm down physiology and it separates you from the thoughts. Those are two critical steps. And I applaud you. I think it's fantastic. So you know, and I know that the misery created with these thought patterns is really horrible.
yes, yeah,
And so I was suicidal. And again, there's a direct link between ruminating thoughts and suicide. I still tell you right now, the second, if I had to live my entire life in that state of mind and say, fine, I'm out of here. I'm not going to do this. And remember,
yeah.
other mammals don't commit suicide like humans. So it turns out that unpleasant thoughts are probably the driving force behind all chronic disease, mental and physical. So as you learn how to calm the physiology, regulate your regulate your physiology, separate from the thoughts, start to develop flexibility in your ego and create a new brain, it's just miraculous what happens. Essentially, none of this is in mainstream medicine. It's
Right.
actually more prevalent in, I don't like the word alternative medicine anymore because mainstream medicine has
Me neither.
very little data to what we do. We have no data. I mean, why are we operating on normally aging spines and destroying people's lives?
I know it's
I had
it's
people
crazy
5,
that
10,
we're doing that.
15, 20 operations before they got to me. One guy, 29 operations in 20 years. So
Yeah,
he's actually been pain free now for about 10 years, never felt better in his life. But again, he created a new brain.
yeah,
So, as far as just summarizing what we're doing, I like to first of all let people know that these obsessive, repetitive thought patterns, ruminating thoughts, whatever you want to call them, drive a lot of bad behavior, addictions, etc., to escape them. And
yeah,
when people talk about stopping their addictions, they use intense control. That makes things worse. So you
yeah.
can it's maintained for a while, but people 5 years later will still go off the wagon. So as you learn the steps we just talked about, let your body calm down, you don't need an addiction to calm yourself down or get rid of the thoughts. So the thoughts will abate. Life is infinitely better not being tormented by these repetitive thoughts. So what I suggest as far as a resource, I have a website called backincontrol.com. I think you've seen that website, right?
I like that name. It's pretty cool.
Yeah. So that's the book I wrote in 2016 is
Yeah,
Back in Control, but I didn't know the physiology back then. So the
yep.
thought
No,
patterns when I came around about 2 years ago. I'm going, wait a second, there's something missing here. So people that go through what's called the DOC journey, direct your own care journey. There's a computer-based course. There's also an app. It's very self-directed. I recommend only about 15 to 20 minutes a day at the most. It's like learning a skill. It's not on fixing the problem. And so
yeah.
the metaphor I like to use is of a ski slope that remember the essence of healing is more safety physiology than threat. And are you a snow skier by chance? Do you snow ski?
I know.
Have you ever been on skis?
Long time ago, I wasn't very good.
Right. So the problem is if you get on a ski slope above your skill level, it is terrifying.
Yes.
Okay, so here's the metaphor. So you walk up to the ski slope, walk up to the ticket window, and they give you a ticket. But here's the catch. You're not given a choice on which run to ski. It doesn't matter your
Oh,
skill level. So if you're a green skier on a blue hill, you're not having fun. If you're a green skier on a double black diamond expert run, you are terrified. So remember, the essence of disease is it's sustained threat physiology. If your life
mhm.
skills are at a level that you're always in threat physiology, it's a problem. So metaphor is teaching you the skills to number one, live and regulate with your stress physiology. And the second linked but separate skill is nurturing joy. As you learn these two skills, you go from blue to green to black to double black diamond ski level. So all of a sudden you have more capacity to deal with more adversity. So under enough adversity, you're still going to go into fight or flight. That doesn't disappear. But you
Right.
can have a lot more fun on a green or blue hill if you're double black diamond skier. So as you increase your skill set, more stresses come under your purview of actually solving. So you have more time in safety, less time in threat. And so in my life, I was a green skier as far as life skills. The only skill I knew
Mhm.
was just keep my mouth shut. Please people, don't complain, work hard. That's all ways of suppressing everything. So as a
Yeah.
master of suppressing things, that's why I became, I mean, being a spine surgeon, by the way, is not a normal way to live your life.
No, that's a lot of stress, a lot of
It's
pressure.
probably one of the highest stress professions that exist. And so I was a green level skier as far as life skills in a double black diamond profession.
Yeah.
And what I did, I didn't even know I was under stress because I was my attitude was I'm tough, and I was tough. So the way I coped with it was bring it on. You can't hurt me. And I got sick.
Mhm.
I got really, really sick. 17 different symptoms is no joke. And
Yeah.
so I get really, really sick. So the reason why, and I also realized at some point I was actually doing spine surgery being done on people's mental pain, not the physical, and it doesn't work. So
Right.
and I was a guy at the end of the day trying to salvage people with multiple surgeries. Their lives were badly damaged by spine surgery, where all they needed to do is to learn how to regulate their physiology. So that's why
Right.
I actually quit my practice in 2019 to actually talk to you and spread the word.
Did you go through a period at all? Did you feel any kind of sort of guilt associated with that? Even it was not your fault. You didn't know, right? You're doing what you were taught. Did you have any guilt going through that?
Well, okay, so let's go back to our conversation. And I think you already know the answer. What I'm going to say is that guilt sort of disappears because if there's no self, there's no guilt. In other words, I don't feel good about it. If I think about a
Right.
certain patient and complication that I did surgery, I feel horrible about it. So
Yeah.
one of the downsides of quote solving this, when you feel bad, you feel worse. When you feel good, you feel better. So yeah, guilt was my middle name forever. And I was
Mm.
not welcomed by the medical profession. I've been getting, the medical profession is not open to this, period. So
No, I
I
know. It's weird, right?
very,
The thing.
yeah. So I would get people better. I would use very few resources. I was watching hundreds of people escape from pain, mental and physical. I was
Yeah.
watching, I was watching hundreds of patients go through that. Then I'm watching 3 to 5 patients a week come into my practice with their lives badly damaged by surgeries on normally aging spines. So I
Yeah.
developed a website. I wrote a book called Back in Control, A Surgeon's Roadmap Out of Chronic Pain. I published that in 2016. There's two editions of that. I wrote another book in 2019 called Do You Really Need Spine Surgery? It goes into the nervous system and the structure to make the decision, which isn't very hard. And then in 2020, I started learning about the autonomic nervous system and the physiology. So I have a process called the DOC journey, doc
Yeah.
journey, self-directed, 15 to 20 minutes a day. I also do a little bit of coaching along with it. But people that
Hmm.
go through the course get better mentally and physically, and it's consistent. And the
That's
reason why I
awesome.
quit my practice wasn't because I was trying to manage pain. I was watching people go to pain free, which is somewhat miraculous. But
Yeah.
the body knows how to heal, as you pointed out, and the level
Yeah.
of healing is beyond words. So watching people going from no hope to thriving at an incredible level, and I'm going, I have to do this. Anyway, that's why I'm here. And
That's
so
amazing.
I'm happy to answer questions and a whole bunch of other things about family issues and anger and all sorts of other things we could talk about in a future date if you would like. So as
Yeah,
many,
I'd like to have you on again because there's so much stuff we can talk about. This is
yeah,
great.
yeah, it's basically about life skills and how do you process stress and how you process adversity to minimize your impact on your nervous system. At the same time, how do you develop the brain that you want? And they're
Yeah.
all learned skills. None of them are very hard. And like you pointed out before, it just takes repetition, repetition, repetition. So
Yeah.
anyway, I'm excited to be on your show and I've enjoyed it. And thank you for having me.
Thanks for being there. This was great. I will definitely get all your information, put it in the description so people can reach out. And we'll set up a date to meet again. We can have these conversations ongoing because there's so much to tackle. It's hard to tackle it in 1 hour. But
Yeah,
thank you.
thank you. All right.
Awesome. Thank you. Bye.